Good day, it's Dale Bader, and we are ready to do yet another edition of Focus on Fertility. Today we are blessed to have a guest from us, joining us all the way from California, Christopher Jackson. He is President and CEO of ReceptivaDx, and he is going to be presenting information today on a brand new or relatively new test. For those of you who might be dealing with prior failures with your IVF transfers or just simply have had failures with unknown reasons why. And so, Chris, we'd love to learn more about the ReceptivaDx test.
Well, great. Thank you for the opportunity. Just as a background, unexplained infertility is an issue that is quite large in the United States, and women that are seeking fertility help, there's a large percentage that even after a lot of the normal testing that they go through will still have that diagnosis of unexplained infertility. And so at that time they'll come and visit a fertility center and they'll look at various options. And our test is available not only as an upfront test for patients, but is primarily used right now for patients that have failed IVF, have had multiple pregnancy losses after an IVF transfer where they thought the embryo stuck and then unfortunately lost it. What our test is doing is it's identifying the cause of that. So even the best fertility centers in the country have about a 65% success rate. So we're focused on that other portion, that 35%, in getting to the bottom of what's going on. And the most common explanation for that, believe it or not, is endometriosis. So with endometriosis, people are usually thinking about that as someone who has heavy menstrual bleeding, painful intercourse, abdominal pain, that type of thing. They don't think of their fertility as being an issue. And so endometriosis, even in a very mild form on the uterine lining, can cause issues with someone's ability to get pregnant. So what we're doing for the first time is providing a test that can identify endometriosis without having to do any type of invasive surgery.
So it's very common for individuals who are going through maybe they're having difficulties becoming pregnant. They'll go through with their OBGYN, and if they have stage 2, stage 3, stage 4 endometriosis, those are pretty easy to diagnose and see. So this is actually going to help diagnose maybe those that are not being truly diagnosed in the office early on. Is that kind of where we're going with this?
Exactly. The patients that we're talking about are patients that endometriosis was the furthest thing from their mind. They did not have any of the classic hallmark symptoms that you think of. And even for the doctors in the reproductive community, you're not thinking that. You're thinking, okay, it's a male factor, we fix that, or it's this and we fix that, or we've got genetically tested embryos. But yet there's still a certain subgroup that continue to fail. And so what our test can do at that point is identify those patients. And you're talking about patients that have tried everything at that point. And now all of a sudden we're coming along and detecting a problem that no one thought of. And it's not only offering hope, but it's offering a new pathway to success for these patients.
So how does this test work? What type of process goes involved for the patient and for the clinic?
Well, the test right now is an endometrial biopsy, and that is done during the window of implantation. So a patient would be watching when they're ovulating and would have the test done, the biopsy taken about 7 to 10 days after ovulation has occurred. It's sent off to our laboratory. It takes only about 3 or 4 days to get results back. And a good majority of the patients, 75% of the patients in the unexplained infertility category, will test positive. And that, is staggering as that sounds, that provides a big opportunity for a lot of people that didn't think they had any opportunities left. Once they've found the endometriosis, the patient has 2 pathways. One is to consider surgery, laparoscopy, where they would go in and look for and remove anything that was there. The alternative to that, and there's going to be some studies coming out soon, where they can use hormone suppression therapy for about 60 or 90 days to give them a course of that. It suppresses the endometriosis long enough for the embryo not only to attach, but to stay attached throughout the entire pregnancy. And so we're getting really good success rates about that. We've got some great success stories coming up. Folks that come to our website, www.ReceptivaDx.com, can actually see some videos of some patients that had almost given up hope, had the test done, had a pathway, ended up with a pregnancy and a successful live birth.
What kind of success rates are we seeing with those patients who have chosen to utilize this test, has gone through some treatment and moved forward at that point?
Well, that's a great question. First of all, that group going in, if someone tested positive for our test, if they were left untreated, subsequent transfer attempts are successful less than 12% of the time. So it's that continuing to do the same thing, expecting a different result. Meanwhile, there's an emotional toll, there's a physical toll, and a financial toll that is this, you can't even describe for what that does with a marriage. So this opportunity for those patients, all of a sudden now, and the treatment paper that will be coming out shows that these patients, once they have the test result and the intervention with the hormone therapy, are back up to a 75% success rate on their next transfer after that treatment. So very, very great results coming out, very positive news for a lot of patients. And we're talking about patients that just about gave up that idea of having a family.
How long has this test now been available, and is it becoming more widely available at clinics across the country?
That's a great question. We now have over 150 IVF centers across the country doing the test. The test has only been out since January of 2017, and we worked as hard as we could to get it out to the community as soon as possible. And it's just now in the past 6 months really taken off because the centers are finding out about the test and its availability. It takes a while for doctors to, they've got so much on their plate to be able to catch up with all the clinical data. And sometimes patients know about the test before a doctor does. So that's always an interesting situation. But we have some great downloads for the patients that can bring into their doctors, discuss that with them. We have doctors that their physicians can speak with as well to consult not only about the testing, but about the treatment options and about those individual patients.
I know this is always a tough question, but when we're dealing with infertility patients, one of the questions always, number one is, what's my success chance going to be? Number two is, what's the cost going to be to me? Is this something that insurance is covering at this time, or is that still in the works, and is it a cash option for patients?
Well, insurance right now is taking a look at it, and a lot of it comes down to the coding of the for the submission to the insurance. To make that a little bit simpler, if you don't have fertility coverage, chances are it won't get paid. So it remains an out-of-pocket test. It's $690, and while I understand that's a lot of money, it's a kind of a great thing to look at before you go and spend money on Right. So it's all relative in that side of it. But for most patients at that point, it's give me hope, give me a sense of direction that there is an opportunity for our families still. And that's the greatest thing about this test in the last 15 months. So what's exciting for us is that there are babies being born last month and this month that are kind of that first group that of babies that were born as a result of their moms getting tested, treated, and then having a successful transfer.
Now, you had mentioned endometrial biopsy, and you and I were talking off air a little while ago. Some people may be thinking, oh, well, I've heard another test that does something like this. It's an endometrial receptivity assay. But as we were talking off air, this is kind of another tool to work together. So they're not replacing each other; they're complementing each other.
That's correct. There's all kinds of tests out there, and your doctors will walk you through each of those and what their clinical utility is. And as a patient, you are a consumer too, so it's good for you to make sure you understand what all these tests do. The easiest way to describe our test is that there are tests out there that will look at the embryos to make sure they're genetically perfect. I hate to use that word, but that's how, genetically tested and graded. And there's a test out there that also decides when the best window of implantation is. So what we describe to people is that you've got this perfect house guest, you've got this perfect timing of when that house guest should show up for the next 9 months. Did you bother to check to see if the dining room table's set right and the living room table's set right? If it's all cluttered, they're not going to stay. And it's the same thing for that egg. So we're checking the uterine lining, making sure there's nothing on there that's going to cause any dysfunction that would prevent an egg from attaching and staying attached.
And are there any upcoming next steps that we should be looking forward towards?
Well, there's a lot of research going on. A lot of it would be premature to talk about. Our long-term goal is to be able to see if we can identify markers such as the BCL6 marker in our current profile in other sample types. We in the industry consider endometrial biopsy being non-invasive, which means it's not surgery, yet at the same time it is painful and we understand there's discomfort. Our goal hopefully later on, even if it's outside of the fertility the world, is to look at technologies where maybe in a pap smear or a saliva test or a blood test where we can identify these conditions at least in advance and maybe help a patient, a young girl at 21 who for no reason should be having the heavy menstrual periods, but maybe has endometriosis, which could end up being long-term scarring that might prevent her from being able to have a baby later on. So if we can identify patients like that, it's a lot better information. 20 years ago, they were told they had irritable bowel syndrome, or that's just your period, deal with it. And they weren't offered a lot of hope. So that's our long-term goal, is to be able to identify endometriosis sooner. Right now, I think the statistic is it takes 11 years for the average person to be diagnosed with endometriosis in our country. And you're talking about the United States, so you can imagine what it's like in other countries.
Well, thank you so much, Chris. This has been very interesting. It's a mind-exploding in some ways because it's brand new. It's kind of hitting the field now, and we're going to look forward to seeing the latest developments coming down the line. And we're big talking about screening, and to know that this could be yet another screening tool, not only now for people going through infertility, but as you were saying, earlier diagnosis of endometriosis and how that can help somebody with their family planning years in advance is pretty exciting to think of as well. So thank you so much.
Thank you. I appreciate the opportunity.
And if you would like to get additional information regarding the Receptiva test, you can visit them on the web at www.ReceptivaDx, that is ReceptivaDx.com. They got some great videos that you can watch as well as get some additional information, or you can always ask your reproductive specialist.
If you've been trying to start your own family and haven't had success, you're not alone. Millions of people just like you are experiencing the same very personal and painful frustration. Infertility affects men and women equally. The Missouri Center for Reproductive Medicine, MCRM Fertility, can help. MCRM accepts most insurance and you don't need a referral. They offer the most advanced science and technology, including exclusive techniques and the EmbryoScope. Check them out at mcrmfertility.com.
That concludes today's episode of Focus on Fertility. We do want to send out a special thank you for Christopher Jackson, President and CEO of ReceptivaDx, for joining us today to talk about the Receptiva test. Again, if you would like to listen to previous editions of Focus on Fertility, visit us online at focusonfertility.net, or if you have questions specifically related to this topic today, or would like to send out a specific request of what you'd like to hear in the future, email me at questions@focusonfertility.net.